Hi guys, this is Iza. So I just want to let you guys know that this video isn't sponsored, and the purpose of making this video is for our group assignment in PHD211, semi-solid dosage form under Dr. Lian. So I hope that you guys can share a positive comment regarding our videos, and yeah, enjoy!
Two very boring minutes later. One eternity later.
So much later that the old narrator got tired of waiting and they had to hire a new one.
Ah, my back hurts. I've been sitting all day. Ooh, what is this? Seriously, she doesn't know what this fennel cream is? Never mind. I'll tell you what this fennel cream is. Fennel cream is a medication under analgesic and antipyretic class in MIM. Fennel cream can be purchased in pharmacy, and they came in two different sizes. For smaller, they have in 30 grams, and for bigger, they have in 60 grams. So if you use it often, I suggest you to go for a bigger size because it's more cheaper. So in each fennel cream consists of 10.20% of methyl salicylate, 5.44% of menthol, and 1.36% of eugenol. It can be used to relieve simple muscular discomfort and painful muscle due to sudden exercise. So now you don't have to worry if you forgot to stretch before your exercise because fennel cream came into the rescue. Since you already know the functions of fennel cream but you don't know how to apply, it's okay, it's just a piece of cake because fennel cream can be applied on the affected area 3 to 4 times daily and the muscle pains will go away. But please avoid applications on the open wounds because you don't want to feel the burning sensation because it hurts. We all know all medications have their own side effects, and as for fennel, their side effect is they can cause hypersensitivity on skin. A heads up, it may cause irritation on skin, and if it does occur, please reduce the dose and frequency of the application. And we know that fennel cream consists of methyl salicylate as it may absorb into the blood circulation, so please avoid excessive rubbing. And patients with warfarin consumption should avoid excessive application on the skin because it may increase the risk of bleeding for them. To ensure the product in a good conditions in a long period, a proper storage can help, as they should be stored in a cool and dry place and protected from direct sunlight, heat, and moisture. Fennel cream that are properly stored can last up to 3 years depending on the manufacturing batch. So that's all from me, thank you, and on to the next medication videos.
Hi guys, so my part, I will talk about teletubbies cream, which is a topical anti-infectives. First of all, we need to know the contents in teletubbies cream. So there are 2% of miconazole nitrate and 1% of hydrocortisone. So the use of this cream is to treat inflamed skin conditions like eczema and dermatitis. On how to use this teletubbies cream is that firstly we need to apply thinly and evenly to the affected skin area 2 to 3 times a day, and then we should rub it gently on the skin area. Next are the precautions and warnings. So treatment must be discontinued if any irritation occurs. You should contact doctor if you experience blurred vision. Must not come into contact with mucosa of eyes. And last one is you should avoid contact with latex products. And these are the possible side effects on using this cream. So the first one is the swelling of the face, lips, tongue or throat, difficulty swallowing, difficulty breathing, reddening of the skin, and hives. This cream should be stored in the refrigerator in the range of 2 to 8 degrees Celsius, and then we need to keep out of reach of children because it will be dangerous. So this cream can last up to 2 years. And that's all from me. We can move on to the next person. Thank you for listening.
Hi, Assalamualaikum. Okay, have a seat. So what's your problem and what can I help you, sir?
Oh, hi doctor, Waalaikumsalam. So I don't know why, but I woke up this morning, my hand got all red and very itchy. So I don't know what happened. I don't know what happened to my hand. Yo, it's very itchy.
Okay. May I see your hand, sir? Okay. Okay, so I'm going to give you this one topical corticosteroid to treat your itchiness. Do you have any problems or allergy with steroids?
No doctor, I don't have any allergy with steroid. I'm fine with it.
Okay, if no, then I'm going to give you this clodum ointment. Okay, you have to use it only once or twice a day. Okay, not more than that, and only apply it to the affected area, only to your itchiness and your redness. Okay. Okay. So if you have any reaction or side effects that you get from this clodum ointment, you can come back later and tell me. Okay.
Okay, thank you doctor. I will use this and only to the affected area.
Yep, that's all. Thank you. Have a good day.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nizadani Aiman binti Muhammad Suhaimi and I am from Group A1. So based on the video that we have seen before, the patient is having a skin problems or itchiness and he is prescribed with clodum ointment by the pharmacist. Clodum ointment is a topical corticosteroid that only have one active ingredient, which is clobetasol propionate 0.0568%, which is equivalent to clobetasol 0.05%. The uses for this ointment is to treat skin problems or dermatosis such as rash, psoriasis, and eczema. Dermatosis and dermatitis is actually quite similar as both are skin problems that caused by bacterial infection. Dermatosis does not cause inflammation to the skin, however, dermatitis causes inflammation to the skin. The second uses is for short-term treatment of inflammatory and pruritic manifestations of moderate to severe corticosteroid responsive dermatosis. So the picture is the example of eczema and psoriasis. So next is the adverse reaction of clodum ointment. The first one is it can cause hypopigmentation, which is the patches of skin that is lighter than our actual skin tone, as shown in the picture number 1. The second one is it can cause burning, itching, dryness, and irritation to the skin, especially when you use it for the first time, as our skin is trying to adapt with the medication. The third one is it can cause skin atrophy, which is the thinning of the skin due to prolonged exposure to steroids, as shown in picture number 2. The fourth one, it can cause acneiform eruption, which is a group of dermatosis that include acne vulgaris and rosacea, as shown in the picture number 4. So this aberration is very severe and not all patients will experience it. The special precaution is to avoid prolonged use and consult with professionals if pregnant or breastfeeding, as it is not known whether this drug will pass into the breast milk when applied to the skin. So next is the duration of use. This clodum ointment must be applied only to the affected area and rub it in, and only use it once or twice a day. The storage and warning is to store below 30 degrees Celsius, keep out of reach of children, do not use in or around the eyes, as our eyes is very delicate and has the thinnest skin in our face. And we must not consume this clodum ointment as it is only for external use only. So the next one is this clodum ointment can last up to 3 years, which is a very long time to to store the clotted ointment. So lastly, this clotted ointment is not an OTC drug, and we must consult with the professionals, with the pharmacy or doctor, to get these medications to treat our skin problems. And that's all from me. Let's move on to the next video. Thank you.
Oh, this is so stressful. 12,000 words, you know. I have a lot of assignments to do. I haven't finished this one. What kind of assignment is this? What time is it now? It's already 4 o'clock in the morning. If I continue like this, I will have a sudden breakout, you know. But wait, yesterday I just bought a new acne gel, right? Let me grab it. Yeah, I remember. I think this will help, right? Who knows? Assalamualaikum warahmatullahi wabarakatuh, and a good day to you. I'm Aiman Sohabi Abdurrahim, and today I'll be talking about OTC Dermix Acne Therapy Solution. So what is in this acne therapy solution? This medication contains active ingredients of 2% salicylic acid. It is used to treat mild to moderate acne and blemishes, including whiteheads, blackheads, papule, and pustule acne. Salicylic acid is a BHA, that means it's a beta hydroxy acid that is an oil-loving acid. So it treats acne by penetrating deep into pores, dissolving sebum, and decrease sebum production. The adverse reactions. If it is used too frequently, it can cause dryness and flaking, and it can also cause mild to severe skin irritation, that is the redness of the skin. It can also cause toxic inner ear damage, ototoxicity, and if it's worse, it can also cause systemic effect, salicylate toxicity, for example, nausea, vomiting, tinnitus, hyperventilation, and vertigo. The special precaution is wash area with soap if irritation occur. Second, if irritation persists, refer or consult a doctor or dermatologist. Patients with impaired peripheral circulation or diabetes should avoid using high concentration of salicylic acid. How to use this medication? First, we must cleanse our face thoroughly and make sure our hands are properly clean before applying medication. This is to prevent contamination to the medication. After that, apply a thin layer over acne-prone area or directly onto blemish as a spot treatment. Repeat this process 1 to 3 times a day. How to store? So, we must store it in a cool, dry place that is between 15 to 30 Celsius to preserve the medication. We must also keep this medication out of reach of children, and this medication is only used for external use, so we cannot take this medication orally. Use before. We must use before the expiry date. The expiry date can last up to 3 years after manufacturing date, and we must also use before the period after opening, that is 6 months after opening. That's all from me. Thank you.
Hey, do you have prolonged eye irritation? Annoying eye booger? And even using eye drop can fix it? Then you should use eye ointment. My name is Sarah binti Yusof, and I am from Group A1, and today I will be presenting about an eye ointment that is called Ophthalmosa Cusi Erythromycin 0.5%, which is an eye anti-ineffective and antiseptic ointment. The content inside this ointment is 5 mg erythromycin in every 3.5 gram tube. The use of this ointment is to treat eye irritation that is caused by infection and treatment of superficial eye infection that is caused by microorganism that is sensitive to erythromycin. These are some adverse drug effects that can caused by this product, which is temporary blurry vision. When we apply the ointment at the eye, the oil in the ointment will disturb our vision, thus make it blurry for short amount of time. Next is allergy. It will be caused by when people who did not know that they have allergy towards antibiotics such as erythromycin takes it. It is advisable to go to the hospital or nearest clinic to get an allergic shot or pills so that it will not be worse. Then there is minor eye irritation and also stinging in the eye. There are some precautions that we should know before taking this ointment. Antibiotic can cause diarrhea, but if the diarrhea are watery and bloody, it is a sign of nerve infection and consultation with doctor is needed. Do not take if you find yourself allergic to it, and follow the prescribed duration of use of the medicine to prevent infection from antibiotic-resistant bacteria. This is the direction of use of this ointment. This medicine may be applied once a day or more depending on the severity of the infection. First, you should wash your hand thoroughly to kill the bacteria. Second, tilt your head above a little bit and look at the ceiling. And third, apply the ointment and blink for a few times. This is the storage and warnings of this ointment. It should not be taken by mouth. It should be stored below 30 degrees Celsius, and it should be kept out of reach of children. Lastly, this ointment can last up to 3 years of use. That's all from me. Thank you.
Hello and Assalamualaikum warahmatullahi wabarakatuh. My name is Syariatul Adawiyah binti Cik Azlan from Group A1. So, for my part, I will talk about kenalan oral paste. First of all, there are two substances in this paste. First is triamcinolone acetonide, 0.1%. Second is benzyl alcohol, 0.5%. Next, this paste is used in the treatment of disease of the mouth. There are a few possible side effects will occur, such as burning, itching, irritation, dryness, and redness of the treated area. Next, we can use this paste by dab or press a small amount of paste onto the area to be treated until the paste sticks and a smooth, slippery film develops. Remember, do not rub. A cotton swab may be used to apply the paste. For the missed dose, if you miss the dose, use it as soon as remember. But if it's near the time of the next dose, just skip the missed dose. Remember, do not double the dose to catch up. For the precaution, if irritation develops, discontinue the treatments. Do not use this paste if you have certain medical conditions. For the handling and storage, keep away from the light and moisture, and keep the paste tightly closed, and also keep out of reach of children. That's all from me. Thank you.